30-year-old male. What to do to slow down aging? I am a 30-year-old male. I notice lines around mouth, wrinkles on forehead, and eye bags. I'm getting Botox, using tretinoin, and putting on sunscreen. I'm wondering what else I can do. I know I am still in the early process of aging, but I really want to do something to look 5 years younger. I was told online that all therapy is not suitable for my age. Then how about laser resurfacing and thermage? Eye bag removal surgery? Facial thermage? Juvederm for lines around mouth? What else?
Thank you for your question. You're 30 years old. You didn't submit a photo, but you're describing in your question a situation where you've developed lines around your mouth, lines in your forehead, eye bags, and you're concerned about ways to slow down aging. And so you have investigated a lot of things. Now you're currently using tretinoin or retin-A, and you are asking about other modalities, and you mentioned certain thermal energy devices that you've been advised is not right for your age, or whether other devices may be able to assist you with your anti-aging quest. Well, I can certainly give you some guidance with this question in the absence of a photo, but I think some general rules of thumb apply which I've learned in my practice, in practicing over 20 years in Manhattan and Long Island. I'm a cosmetic surgeon, board certified by the American Board of Cosmetic Surgery. I'm also a fellowship-trained oculofacial plastic and reconstructive surgeon, so I can certainly also talk to you about ways I deal with facial aging related to under-eye bags as well as other facial aging changes. So, to begin with, when it comes to anti-aging or the slowing down of the aging process, I always like to think first holistically. When you think about what accelerates aging, just think about stressors. Stressors include lack of sleep, poor diet, toxins such as smoking, such as excess sunlight. So begin with the foundation and take good care of yourself, your health, and do all those things that are intentionally good for your body. Now, putting that aside, as far as under-eye bags are concerned, one of the most common problems we deal with in our practice is under-eye bags. And this is because under-eye bags transcend both age, gender, ethnicity. It really is something that occurs at very young ages. We've operated in patients as young as in their teenagers, as well as people as old as much later decades, 80s and beyond. So, if the bags under your eyes are persistent and significant, well, performing a procedure for under-eye bags is fairly straightforward, depending on the degree of the under-eye bag. For example, if a person has mild under-eye bags, well, then I can actually camouflage the under-eye bags with a non-surgical option, such as the placement of a filler like Restylane, and combine that typically with a metabolic treatment that we use called platelet-rich plasma. The idea is that platelet-rich plasma, which is derived from your own blood and is a concentration of the wound-healing growth factors that are released when you have a cut. Basically, we separate out the key elements and we inject that under the skin to help stimulate collagen. It improves discolorations, dark under-eye circles, and it helps to really work in synergy with a filler like Restylane. Now, if your bags are more significant, then the option of a surgical procedure becomes more relevant or is indicated. And this is a procedure that for a younger man who's, let's say, 30 years old like yourself, we do something called a transconjunctival blepharoplasty. Transconjunctival blepharoplasty means that I'm able to address the fat pockets from the inside, from behind the eyelid, without any outside incision or scar. It's a very, very popular procedure in our practice. We do it pretty much every day of the week, and it has a dramatic effect on the person's overall appearance. It is fantastic not to have under eye bags. In terms of the other issues, there are ways to be proactive, and sometimes it does make sense to do things such as Botox, to use some fillers such as the hyaluronic acid fillers. But in general, I think you can be measured and careful about how much you invest into this type of into the many services that are offered to help people with facial aging. Basically, think about doing things holistically, and then a little bit of Botox, a little bit of platelet-rich plasma, and maybe the periodic use of an injectable and something good for your skin, whether it is something like a microdermabrasion, or in our practice we use something called HydraFacial, which is a glycolic acid-based method of technology using water to help exfoliate the skin and stimulate the skin. So I think you need to meet with some doctors, learn about the options and figure out what makes sense for you in terms of outcome and, of course, in terms of budget. So I hope that was helpful. I wish you the best of luck. Thank you for your question.